Hello guys, welcome to my YouTube channel Ajna Pharmacy. Yes, in this video today let's discuss about the very important concept, that is of constipation. Okay, everyone in this life has undergone by this problem, that is a constipation. Actually, what is this constipation? Some symptoms are there, causes, diagnosis, treatment. With treatment we will discuss dose also. One particular drug is there, how can we take that? It is a prescription based drug, so this video is only for the knowledge purpose. Understand it. Okay, increase your knowledge, that's all. And prevention also very important here. How can you prevent this constipation, by what measures? That all we will going to discuss in this video. First one, let's discuss what is this constipation. See, chronic constipation is infrequent bowel movements or difficulty passage of stools that persist for several weeks or longer. In simple, see, those who are difficulty in passing the stools or passing the waste products, okay, through the anal cavity, very difficulty. They are applying pressure, that all they are doing. We too, because we are suffering from this problem in once our lifetime, because our food problem. Okay, so this is the constipation, simple. And constipation is generally described as having fewer than 3 bowel movements a week. See, if regular bowel movements is there, means a person is very healthy. If the bowel movements is less than 3, means weekly he will get 2 bowel movements, 3 bowel movements. Sometimes he will get 15 days 1 bowel movement. That is very dangerous, chronic constipation. Okay, if it is not treated, it leads to hepatic encephalopathy, means all the waste product means amino acid which is generated, no, that will goes to the brain. There it will start deposition in the brain, that leads to seizures or mental retardation. It leads to confusion, etc. So removal of the waste from the body, that is amino acid, is very essential. Clear? Are you getting what I am telling? Constipation generally it is the infrequent bowel movements or difficulty in passage of the stools. When the patient is said to be constipation, the patient, if his bowel movements is less than 2 or 3 in a week, 4 bowel movements, 5 bowel movements, no problem. Less than 3 to 2, that leads to the constipation. Then symptoms, see, passing fewer than 3 stools a week, it is a common symptom. First symptom is passing only 3 times in a week, having a lumpy or hard stools. The stools are lumpy, means cutted stools, lumps are there in that stools, and hard, very hard, no softness in that stool. Then straining to have bowel movements, straining, pressure is applied. Then feeling as blockage in the rectum. This is the rectum you are observing. So this one is the rectum. You will feel the blockage in that rectum. Okay, because there may be chance of a blockage in the colon. We will discuss next in next the causes. Then feeling as you could not fully empty the rectum. Okay, you will feel like that you have not emptied your rectum completely. Some amount of the debris, some amount of the stool is present in the rectum. You will feel like that way. Then stomach pain. These all are the some basic symptoms of your constipation. Next is the causes. In the causes we will discuss here. See, blockage in the colon or rectum. Here it is blockage. You will observe here blockage in the colon. That results main important cause. Next is anal fissuries. You are observing here anal fissuries. Here just fissuries means crack on the anal membrane, crack on the epidermis of the anal layer. Here crack. That crack may lead to the constipation. Then colon cancer, narrowing of the bowel, mental disorders like schizophrenia patients or seizure patients, they cannot pass the bowel because they are unconscious. So it is also one cause. Diabetic patients, pregnancy, these all are the some of the different varieties of causes for the occurrence of the constipation. And actually this constipation majorly observed in the infants, in children, and in old age peoples. Okay, we actually observe here only in majority of the cases. Nowadays in America 2.7 million people are suffering from this constipation. Main reason for this constipation is bad food, the food that doesn't contain fibers, that leads to constipation. If you leave this constipation for a longer period, it leads to the several disorders. So eat healthy food. We will discuss in the prevention that what you have to eat to keep your colon good, to keep your body healthy. Diagnosis, simple tests are there. Blood test helps to determine the concentration, what is the concentration of the calcium is present, then thyroid hormone is present. Excessive thyroid also leads to this, hypothyroidism also leads to constipation. X-ray tests are done so to determine the how much amount of stool is present in the colon, that too we can determine. Okay, then colonoscopy, this is a colonoscopy. Just what we are doing means, see this one, we are inserting the camera based tube inside the colon through the rectal cavity. You are observing on the picture. CT scan, blood test, these all are the we are doing to diagnose this constipation. Okay, then treatment, basically see, improving fibers in the diet is the basic treatment. Drinking lot of water, drinking more water, exercise, then lubricants also sometimes they will help, like glycerin or paraffin liquid, okay, castor oil, they will help. Then medicated drugs, for an example lactulose, milk of magnesia, bisacodyl, enemas, suppositories, these all are the examples. So treatment, this one is a treatment. See here some drugs are there, that is Dupalac, milk of magnesia, Dulcoflex, suppository basis for adult and children, 5 mg for children, and for the adult is a 10 mg that contains the suppository. Clear? Are you getting what I am telling? Yes, these are the some treatment. Now dosing is, see, we will take here example of the lactulose. It is a osmotic type of the laxative. Here the dose for adults is 15 ml once in a day. Better 15 ml you can give at the night time, because to show its action, okay, these lactulose, these laxatives will take 24 to 48 hours. So better to take at a night time only. Maximum 60 ml per day we can do in a divided dose if the condition is very critical. And in hepatic encephalopathy we can give 30 ml for a particular hour until the bowel will pass. 30 ml. After 1 hour again we will give 30 ml by means of the infusion or enemas. Then children, see, 1 to 3 ml per kg, that is, for an example, if the baby is a 10 kg, then we will give 30 ml per day in divided doses. In divided doses we can give, maximum dose is 40 ml per day we can give. Okay, 40 ml per day you can give. 30 ml per day normal children, according to the body weight you can divide the dose. Yes, this is the dosing pattern for both adults and the children. Now prevention, how can you prevent? It is very important. Avoid dairy products like milk products, curd, these all contains these what they will do, they will reduce the water content. Then processed food, meat, pickle, that too you have to neglect it. Okay, then drink plenty of water, very important solution for all. Plenty of water is very important. Avoid fast food like gobi manchuri, then pani puris, these all fast food, they will absorb all the water quantity and they forms the hard stools, very difficult. Avoid caffeine and tea, they too will dehydrate our body. Okay, hydration is very important here. Keep your body hydrated. Move your bowels when you feel the urge, when you are feeling that you want to pass the stool, go and pass your stools. Don't sit, don't wait for that, because maybe it will go back. Okay, it will go back, the stool will go back, and that leads to the constipation. Then eat fresh fruits and vegetables. Eat fresh, you can eat grapes, pomegranate, watermelon, these watery content juicy fruits you can eat, so that you can prevent this constipation. Yes, these are the simple treatment, diagnosis, causes, symptoms, prevention, for the constipation. So if you like this video, subscribe our channel Legion Pharmacy to get this type of important knowledgeable videos on related of the disease. Thank you.